and the participants today, and we welcome our public for public comment as well. Today's hearing will be focusing on the Department of Managed Healthcare and the Managed Risk Insurance Board and the Department of Healthcare Services. There will be no vote-only calendar today. All items will be up for discussion, and we will, of course, be taking public comment after each agenda item. We will be limiting public comment to 1 minute per person, so we have an opportunity to hear from everyone on this very packed agenda. So with that, I would like to go ahead and welcome the first panel, Shelley Roulard, Director of DMHC. Please come forward with your great staff. And I know we have LAO and DOF coming forward as well. Welcome to you too. And I know you will be responding to the questions we have asked you. Thank you very much.
Good morning, Madam Chair, members. I'm Shelley Roulard. I'm the Director of the Department of Managed Healthcare. I'm happy to be with you here this morning. So I'm going to start off with just a brief overview of the department, although I know you are quite familiar with what we do, but just for the record, the department is a consumer protection agency that licenses all the HMOs in California and several PPOs. The plans that we license provide coverage to about 20 million Californians, representing about 90% of the commercial market. Our budget proposed for 2014-15 is about $59 million and almost 400 positions, 397 positions. The department's funded primarily by special funds that come from an annual assessment paid by the health plans, but we also get some federal grants and reimbursements as well. Our key functions, number one, is our Consumer Help Center. Since the department began in 2000, we've helped over 1.5 million Californians with problems that they may be having navigating the healthcare system, dealing with their health plans, having challenges. That Help Center is available to people who are commercially insured, people who are on Medi-Cal managed care plans, and even individuals who may be uninsured looking for coverage, and I'll talk a little bit about that later. The department, of course, licenses health plans. We look at all aspects of the health plan's operations, including provider networks, evidence of coverage documents, marketing materials, et cetera, and all those have to be approved by us. The department also conducts routine and non-routine medical surveys, which is where we go into a health plan and look at their various policies and procedures, how they handle grievances and appeals, their utilization management processes, how they deal with quality issues, we conduct those surveys once every 3 years for each of the plans that we regulate. The department also actively monitors the financial solvency of the plans by doing financial exams, also once every 3 years. We also review proposed premium rate increases. It was one of the programs established under the Affordable Care Act, where we determine whether or not plan premium rates, proposed rates, are not unreasonable. We also, of course, enforce the law. We have an enforcement division who gets most of its referrals through the Help Center, through the actual individual consumer complaints that we deal with, but also, through our financial solvency and licensing divisions as well. That's pretty much the overview of the department. If you have any questions, happy to answer them.
Thank you very much. First, we'll see if LAO or Department of Finance has any comments on this. All right, thank you very much. Questions, comments, members? Senator Monning.
Well, good morning. Thank you for joining us today. And I just wanted to follow up on the 24-hour help center. We've talked some about this, but roughly how many employees are engaged in the help center?
I think there's about 130 or 40. Right? Yes. Okay.
And
it's about a third of our staff.
Uh-huh. And the language capacity of those help centers?
So we have staff who speak Spanish, and then we also have the interactive voice response that has messages for people in other languages. I don't know the exact number, but if you want that detail, I can have somebody come up to talk about that. And then there is a language line for all the other various languages that people speak in California.
Right. And then when you receive a complaint, you maintain a record of how that complaint is resolved?
We maintain a record of the activities that we take to resolve the problem. Sometimes when calls come in, it's a matter of referring the person somewhere else to resolve it, and we may not necessarily know whether or not that problem got resolved, though typically we'll say, if you're still having a problem after you call the health plan or wherever we're directing them, to call us back. So we do get feedback that way on how effective our help is.
Right, so that'd be one category of call that gets referred, and then a category that is within your oversight.
Yes.
You would maintain a
we-
track of how it's handled, nature of complaint.
Yes, we do. We have an extensive categorization of issues that we use to identify what the problems are, and that's how we identify systemic issues that may be coming, because we do look at patterns of complaints, and those are the types of things that would then potentially get referred to enforcement. I should also mention, what I neglected to mention about the Help Center was our independent medical review program, where somebody who has been denied a care or service has the right to have that reviewed by an independent medical examiner, and the Help Center manages that. And we do, of course, get the results of the IMR decisions, which are binding on the plan. And I would just add that, somewhere around 60% of the requests for independent medical review actually get overturned at either by the medical review organization or the plan reverses it before it actually goes to IMR.
And then just final question, roughly, you may not have this at your fingertips, but the percent of calls that come into your helplines that do get referred to to Department of Insurance or somewhere else?
Do I have that? Oh, thank you. No, Andrew came up here.
Good morning. I'm Andrew George. I'm the Deputy Director of the Help Center. I can provide you more specific figures, but my guess would be it's somewhere around 10% of the calls that we might have to refer out either to the Department of Insurance or have to refer back to the health plan for the member to participate in the grievance process, or perhaps to some other entity that has regulatory jurisdiction over them.
Yeah, well, that's helpful. So vast majority that are coming in relate to an issue that DMHC has oversight.
Absolutely.
Yes.
Yeah, I think that's a pretty safe statement. And just to enhance what the director said as well, so we track every single contact that comes into the Help Center, whether that's a telephone call, whether that's an email, or whether that's an actual complaint. So all of those inquiries are tracked and trended.
Great. Thank you. Thank you, Madam Chair.
I have a couple of questions along those lines, too. Of the cases that stay in-house that you don't refer to other agencies, how do you track to determine that somebody who's called has received satisfaction? In other words, their issue has been resolved. Do you track that percentage?
So for every single complaint that we receive, we're required by law to send a closing letter to that enrollee. And that's required to be sent within a 30-day period. So everyone that comes to us with a consumer complaint issue, whether that's an independent medical review issue or some type of other issue, they're going to receive a letter from us that essentially tells them what our resolution of the complaint is.
Okay.
Telephonically, we'll tell that person, hopefully within the context of that actual phone call, here's what we're going to do, or here's where we're going to refer you, or we'll try to follow up with them if it takes us a day or two to get them that information.
And could you just let me know a little bit more about how you might receive complaints or questions, concerns, requests for help online? Is there any sort of online process, or is it just by email? Or
So beginning, I think it was in November of 2012, and I'll verify that for you, we moved to an online complaint form. And the purpose of that was for, so that somebody could, if they got a denial from their health plan in their grievance process, they could simply go online, pop up our online form, and submit a secure complaint to us directly. So that's been very successful for us, and I think since then we've had over 2,000 complaints just through that process. Folks can reach us that way. They can telephone us and follow up with a written complaint. They can reach us through our helpline email. And then also, obviously, they can use traditional methods of just mailing in the complaint form as well.
Okay, thank you very much. Any other questions, concerns, members? Thank you. Any public comment on this item? Please come forward. 1 minute, please. Good morning.
Beth Capel, Health Access California. We were the organization that sponsored the creation of the Department of Managed Healthcare because its predecessor was utterly indifferent to consumers. It is a pleasure to hear them say that they are a consumer protection agency, and I would just note that they've understated some of what they do. Many of the calls they get never turn into formal complaints because they get the HMO on the line and resolve it right then. I'm not going to say they're perfect. There have certainly been some challenges, particularly in the autism area, but there are some remarkable improvements over their predecessor. Thank you.
Thank you. That was very nice, wasn't it?
Thank you, Beth.
Good morning.
Good morning, Madam Chair and members. Vanessa Kahina with the Western Center on Law and Poverty. To echo Ms. Capel's statements, it has been a pleasure to work with DMHC over the past several years, particularly since the implementation of, or part of the implementation of AB 922, which has incorporated DMHC into Health and Human Services Agency. They have also granted the Health Consumer Alliance several contracts with which our legal aid organizations throughout the state can assist people on the ground with more complicated in-person kinds of cases. So when they come asking for things this year, I think we'll be supporting those. Thank you.
Thank you very much. Thanks for the positive message. The next item is the federal mental health parity rules, and welcome again.
Thank you. So the department, as you know, is responsible for ensuring access to all kinds of services, through the health plan. So I want to just assure the committee that ensuring access to mental health services in compliance with state and federal law is a top priority for the department this year. Just as background, as you know, in 2008, the federal, I'm going to call it the Wellstone Act for brevity, was enacted. Interim final rules were released in February 10, and that's the structure under which we've been operating since then. But effective January 1st of 2014, the department has explicit authority to enforce federal mental health parity in the individual and small group markets. And final federal regulations were issued last November, and those detailed how the health plans must analyze and achieve federal mental health parity. They also spell out the implementation timelines for the various market segments. So the rules demonstrate that federal mental health parity is vastly different from what we have in California law currently. And in your briefing documents, you have the requirements, but I'll just briefly go over them, which is, well, first, to classify all benefits into federally mandated classifications. The plans are going to have to do a mathematical analysis of all the benefits to ensure that the financial requirements, such as co-payments or co-insurance, and quantitative treatment limitations, such as visit limits or days of treatment, are for mental health and substance use disorder, are not more restrictive than the requirements or limitations applied to medical or surgical benefits. Thirdly, the plans will have to analyze all the benefits to ensure that any non-quantitative limitations, such as medical management standards regarding medical necessity, apply comparable processes, strategies, and standards for both mental health and substance use disorder as to medical and surgical benefits. That's a mouthful. So, it goes without saying that the compliance review for federal mental health parity will be vastly different from anything the department has done before. So as such, the department's in the midst of an extensive analysis of the regulations, and we're undertaking a department-wide planning process. But I can say that consistent with our approach to plan oversight, we will be conducting both a prospective and a retrospective review of health plan compliance. The department expects to begin review of health plan compliance around the middle of May, which is when the health plans will be submitting their qualified health plan filings for individual products sold through Covered California. Such prospective compliance review for all commercial markets must be completed by the end of the year, when all the market segments, large group, small group, and individual, must be in compliance with the federal rules. We will also conduct follow-up compliance through the medical survey process, consumer complaints that we receive, and enforcement actions that we take. The department is still in the process of evaluating what resources we may need to conduct this review. So, happy to answer questions.
Thank you very much. I believe we may have some, well, first of all, LAO, Department of Finance. Senator Bell, do you have any comments or questions on this item?
Yeah, thank you for allowing me to share your meeting. I have to go chair my budget subcommittee, so I'm appreciative of having it on the early part of your agenda. So as we have worked in the mental health caucus of the Senate, we are interested, and we sent a letter to the chair outlining the interest in seeing a mental health parity enforcement program in the Department of Managed Care, essentially. I support the leaving this item open so we can continue to work on it over the next several months. But it's my expectation that we will have an enforcement unit so that we don't rely on a complaint basis. The principle is we don't want to rely on a complaint basis because people with addiction and mental health problems simply don't complain enough. And then by the time they do complain, it's too late. You want to put it that way. So we need to have some proactive work, comprehensive proactive work in terms of yearly reporting, giving information on mental health parity with the health plans of California, so that we can honestly say that the health plans are implementing the parity law. We shouldn't just wait for people to complain about it, because that just doesn't work. And we need to recognize the fact that there are so many people in California that actually have health insurance that does cover some mental health conditions. But still, even though they have these mental health plans that cover them, simply don't get the care needed. And so it's up to us to establish the process of enforcement of the mental health parity by having a department care for those essentially who can't care for themselves. That's what it amounts to. They can't care for themselves, so we need to have, and I don't say that very often, but I think complaint bases work a lot. The yearly review and that kind of stuff, it works, but you have to have, I would say, a more serious level of enforcement for somebody that has mental health and substance abuse, and most of the time both, actually. So the other thing in terms of the budget, uncared for mentally ill simply go to the public institutions and are costly in terms of the Medi-Cal program, our social service agencies, criminal justice agencies as well. So I think it's very important that the Department of Managed Care at least enforces the law in terms of insurance for people that have insurance before they get to such a condition where they can't conduct themselves in employment and then are unemployed and are on the Medi-Cal system. So that's a fiscal impact that we have to recognize. I think the only question I would have today is that can we have this set up by the deadlines that are established, and they're in your report, you put those down. We want to make sure that they're established, because there's something in your report that's not mentioned, and that's that if you don't do it, then the federal government, in the law that they have, they will do it in accordance with their guidelines. They will enforce, people will go to the federal government, and we couldn't end up with sort of like a situation where we're, I hate to say it, but a situation like we're in with the state prison system. We have an overseer that's kind of dictating to us how to spend money, and we sort of don't have control over a lot of those things. So let's do it the right way, on time, an efficient system where it's easy for the consumer that has a mental health and substance abuse condition. Make it as easy as possible. And that's all we're asking for. It should be funded by managed care fees. I'd like to know if we're going to be on schedule, basically. That's the question.
Well, it's certainly our intent to meet what the law requires, and that's why we're starting the planning process already. And, you know, as you said, this needs to be done by the end of the year, and we're going to do everything we can to make sure that we meet that deadline.
Thank you very much, Senator Bell, for joining us, and thank you for your continued advocacy. We will be, of course, taking your thoughts and concerns into consideration as we move along, as we keep this item open.
Thank you.
Thank you very much. Any other questions, comments by members? All right. Any public comment on this item, please come forward.
Good morning, Madam Chair.
morning.
I'm Randall Hager. I have a dual role today. I'm representing both the California Psychiatric Association, but I'm also an officer of the California Coalition for Mental Health, and my comments will cover the position of both. To Senator Bell's point, I think the department has data on its website that shows that consumers of mental health services complain about 3% the rate of their peers who have health issues. And so I think it's absolutely critical that we do have a data stream that does help compensate for that. The medical survey system, we participated in the focus survey that the department did in 2005-06. It's a wonderful tool, but we need to go, I think, a step further and find ways to elicit the information that both consumers and providers have at the point of service. There may be a number of ways to do that. You know, thinking about surveys, a lot of the surveys that my members get as psychiatrists are not that effective. They're what one of my members calls kind of a beauty contest. How did you like us? You know, they don't really delve into the detail. But we could talk about plan reporting. We could talk about the department maybe reporting on an annual basis. We could talk about structuring the reporting with national standards like the Utilization Review Accreditation Commission standards on parity. We might talk about our report card from the Office of the Patient Advocate. There's a lot of different ways that I think we could ramp up and meet the demands of the final rule, and so we look forward to continuing to work with the department and the committee to see what those ways might be. Thank you.
Thank you very much. Good morning.
Good morning. Thank you, Madam Chair, members. Tom Renfrey with the County Alcohol and Drug Program Administrators. Despite the passage of the parity laws, we're finding that still a lot of people with mental health or substance use disorder needs are not able to access the treatment to which they're entitled. I was just speaking with one administrator this morning of a medium-sized county who told me that the health plans there have only been able to find 4 mental health providers in that county and 0 psychiatrists. This is a big problem, and yet these plans are still collecting their per member per month for people that need these services but aren't able to get access to them. So with over 500,000 people with mental health and substance use disorder needs now eligible for health insurance under the Affordable Care Act, we would agree with Senator Bell that we need stronger enforcement policies to make sure that plans do comply with this law. Thank you.
Thank you very much.
Hello, Madam Chair and members. I'm Rebecca Gonzalez with the National Association of Social Workers, California chapter. We want to thank Senator Bell and the work of the Mental Health Caucus on this issue, and we do agree that enforcement and preventing problems is the way to go, and it will solve, save money in the long run and also help clients. Thank you.
Thank you very much.
Good morning, Madam Chair and members. My name is Khalif Osagai. I'm the legislative. All right. Good morning, Madam Chair and members. Khalif Osagai with NAMI, California. We are similarly in support of a more proactive enforcement mechanism for enforcing the mental health parity laws. As Senator Bell said, a complaint-based model leaves people without care. And so our priority for our 19,000 members is access to care and timely access to care. And by the time you complain, clearly you haven't had that access, and then there's quite some time before you're actually going to have that complaint addressed. So we support dedicating resources towards enforcement, hopefully through the Mental Health Parity Enforcement Budget Act, which we support. And we thank Senator Bell for his leadership on this issue. We also thank the committee for their consideration of this priority. Thank you.
Thank you very much.
Good morning, Molly Brotzell with the California Mental Health Directors Association. In the interest of time, I'll just lend our support to the comments made by my colleagues here, but I also wanted to underscore a point made by Senator Bell regarding the impact on our public system when appropriate access isn't provided by the commercial sector to mental health services. Thank you.
Thank you.
Good morning, Honored Chair. I'm Andy Murphy with the California Mental Health Planning Council, and I'm also here to basically agree with everything we've heard so far. One of the things that hasn't been mentioned and may or may not be of interest is that the SAMHSA block grant, the Community Block Mental Health Grant, is worth $57 million to California. And one of the specific criteria that they ask the department to put forth is what are they doing in terms of integration of services and also in parity and enforcement. So I hope that this will be the year that we can actually get this solidified and off the ground. Thank you.
Thank you very much. All right. Thank you very much. Well, the recommendation is to hold this item open.
Thank
Everybody
you
okay
very
with
much.
that?
I appreciate the department and the committee and the testimony, and we'll be working with you throughout this time. And I'll go back and chair my meeting.
Thank you. It was great to have you here, Senator Bell. Thank you very much. All right, so we'll hold that item open without objection. All right, next item, the new customer relationship management system. And welcome to the speakers again.
Yes. So the department's been using a database management system for all the complaints, the consumer complaints that we get since 2000. It's called the Clarify system. That system is outdated and needs to be replaced. And so we've determined to purchase a different system called On Contact. So this proposal redirects existing consultant services that used to do all of the work on the Clarify system to fund 2 permanent IT positions effective July 1st, 2014. So these positions will do IT programming services for the new system On Contact, which has currently been performed by contracted vendors. So there's a zero cost proposal.
All right. Is that it?
That's it. Short, sweet.
So this is a question that I ask whenever I hear about new IT systems. Is there an opportunity to work between agencies and between departments to sort of share resources and brainpower in the development of these systems?
So which departments were you thinking
Well, it's
of?
just a general question overall. It just, I could talk on and on about some of the challenges we have in the state in updating systems and concerns we've had in the past, and I'm just wondering if you've looked beyond your department to see if there are opportunities to share resources in the development of these systems. People are hiring in-house, so there's an opportunity perhaps to have some sort of work done between departments.
So under AB 922, Senator Monning's bill, the Office of the Patient Advocate was charged with kind of identifying different database systems that our department, Mr. MIB, DHCS, and other agencies had, and that project is underway. In terms of this particular database system, it is unique to the Help Center, and I'm going to let Andrew talk about if there's any coordination that we've done with other departments on this.
Not at this time.
Yeah.
Okay. It's always a good thing to think about. Department of Finance?
Adam Dorsey, Department of Finance. I would just note that, our colleagues at CTA aren't here, but certainly, they serve as a role of oversight of IT projects statewide and share some of the, wisdom from other projects and that sort of thing, too. And so certainly, they might be useful to reach out to for, future discussions on cross-cutting IT issues.
I just think it's always a great opportunity because we have a lot of, unfortunately, mistakes to learn from, and we don't want to repeat those. So that's one reason why I asked that question. Okay. I'm sure you will make all the best choices and look at it all very carefully, but I just think there are opportunities for us to share resources and brain power and knowledge across departments. LAO? All right. Okay. Any comments, members? Public comments? Please come forward.
Good morning, Madam Chair, members of the committee. Mario Guerrero with SEIU Local 1000. We certainly wanted to voice our support for a lot of these exercises the various departments are going through in terms of looking at jobs and looking to see if it makes sense to insource to do these jobs more efficiently and less expensive. We also want to point out that it's not always about having staff, having current state workers that have the skills. It's also about training current staff to have those skills and also to hire staff that have these skills. So we appreciate the exercise. We look forward to more of these as we work towards having good government that is efficient and, again, can do these items cheaper. Thank you very much.
Thank you very much. All right, that item will be kept open without objection. And the next item is the Medi-Cal, AB1X Medi-Cal expansion workload. Welcome.
Yes. So this legislative BCP proposes 18 positions for fiscal year 2014 and ongoing. Most of those will be at the Help Center, including a couple of attorneys and nurses, some analysts and consumer assistance technicians, which are the folks who answer the phones. There's also funding for 3 positions within the Office of Enforcement. So the purpose of it is to provide assistance to consumers who are newly covered in Medi-Cal managed care, as well as increase support for enforcement activities as a result of the expansion. Do you want me to go on to your next question? Or?
Yes.
Yeah, okay. So you had asked how the call center responds to questions that are beyond its purview, such as when we get calls about eligibility and general inquiries. So the Help Center staff are trained to respond to most general inquiries regarding the healthcare delivery system overall, and they will always attempt to provide direct assistance or refer the call as appropriate. And some of the examples of referrals that we would make include calls from Medi-Cal managed care beneficiaries who are having difficulty with the enrollment process, such as delays in the processing of their application. So those are referred to Healthcare Options, which is the branch of the Department of Healthcare Services that handles Medi-Cal enrollment issues. Another potential referral from the department would be for callers who have yet to enroll but are seeking information about enrolling in Medi-Cal. And they could be referred to one of our community-based organization partners that Ms. Kahina spoke about. Our department contracts with legal services programs throughout the state to provide local, in their community assistance for some of the more complex issues. And one of the issues that they're experts at is around the Medi-Cal application and eligibility process. And those CBOs also provide consumer assistance to Medi-Cal beneficiaries who are enrolled in county organized health systems, which are not under the purview of the department. All other issues relating to Medi-Cal managed care are handled by the department. They are entitled to avail themselves of all of our complaint resolution processes, including independent medical review. We also sometimes get calls from, this is not quite related, but for people who are enrolled in Department of Insurance products, and those would be referred to the Department of Insurance.